We have also invited my colleague, Mr. Kelvin Liew, on the panel to answer any queries on scholarship and sponsorships later on as well. So moving ahead, I would like now to take this time to start our panel dialogue and invite our following speakers back into the session. We will have Mr. Tan Kwang, our CEO of AIC, to share also more about his thoughts and views. We have Mr. Chua Heng, Senior Medical Social Worker from St. Andrew's Community Hospital. We have Ms. Seng, Physiotherapy from St. Luke's Eldercare. Last but not least, we have Ms. Abigail, our Assistant Director of the Manpower and Talent Development Division, to join us for the panel dialogue, please. But just as a short intro about Ms. Yo, she has a very wide experience in both public and private sectors, with specialization in learning and talent development, and has also been involved in a wide range of work covering HR business partnering, talent acquisition, performance management, systems implementation, and policy formulation. We're very pleased today to have all these experienced speakers to join us today to share their insights. So yes, I would like to get the ball rolling and perhaps ask some questions to our panel that have been surfaced out in some of our previous talks and webinars. The first of which I would like to address to our CEO would be, why did you choose to join the community care sector?
Yeah, thanks so much, Lynn. To your question, firstly, I've been in the public, private, and the people sector. So I think as compared to my colleagues on the panel here, as well as, of course, all of you, I'm much older, spent a lot more years, in different roles as well as different organizations. So having worked in the public sector for more than 11 years, and then I went into the private sector, I worked at McDonald's for a couple of years before I joined public healthcare. I would say that what resonates strongly with me, I think, is the purpose of what we do, which is really to help care for others and help them actually live the life that they would. So that resonates with me in healthcare, which was the reason why I joined in the first place. And I was an MOH holding quite a number of years back. But in community care, the reason that I really felt is something I would like to contribute towards is this is the vision that we want to be able to allow or to empower our Singaporeans to be able to live well and age well at home and in the community. I still volunteer quite a bit with Touch as well as the Silver Generation ambassadors. With Touch, I deliver meals as part of their Meals on Wheels program as a volunteer. And each time when I go out and I speak to our seniors out there, and you get to know them a little bit more, right? You realize that actually a lot of, in most cases, actually what they will want is really to be able to stay where they are, live at home where they have been for many years. They want to actually be enabled and empowered to do what they love to do, right? And this applies, in my view, to all of us in any stage of our life, right? Although what we love to do, of course, will change. And actually what they need is just the care and support and understanding of what they actually would need at their phase in their life. And perhaps also someone, a friend, a partner, agency just to age with them as they grow old. So that's when I felt that what we do in community care sector and the AIC really resonates very strongly with me and continues to drive and motivate me. So if that's something that also drives you and you feel that's something that you like to contribute to, then I would strongly encourage you to consider community care.
Thank you, Casey. Would the other panel speakers also like to share your thoughts as well?
Anyway, before, like Heng and shares, right? I was looking at some of the Q&A questions. They were also asking Anne and Heng, what made you decide to do that mid-career switch, right? And then what motivates you to stay in the sector? So it would be very apt at this point for Heng and Anne to share your views on, why do you choose to join the community care? I'll pass on to the both of them to share.
Then maybe I go first.
Yeah.
So for myself, like I said, previously I was working as a paramedic. So I was actually a paramedic for 12 years. So I think it's just a natural progression where I came to a point I felt I wanted to maybe do more. But at that point in time, I felt it wasn't possible. So I was thinking of maybe an alternative career because I felt very stagnated at that point in time. I knew I love healthcare. I knew I loved healthcare, and I also knew that I wanted to be in the helping professions because it was something I felt very rewarding. And I also wanted a career that I can continuously learn and grow, never stop learning. And so I think I chanced upon social work. And the values of social work resonated with me. So I wanted to go into social work, and that's why I signed on with PCP. With regards to community care, I think I didn't have any preconceptions about what to expect, whether is it good or bad, So I went in, because for PCP, I had to partner with an organization, and St. Andrew's Community Hospital was the one that chose me. So, but having gone in, learning more about social work and the importance of the community care sector, because as good as the healthcare sector is, if your community care sector, it doesn't follow in tandem, right? Patients will not be able to go home well supported. So from my own experience at St. Andrews, as well as my learning of social work, I realized the importance of community care. And I realized how much more contributions I can make in this sector and what made me continue to stay. And I felt my career at St. Andrews very rewarding so far. I think this year will be 8th year, coming to 8th year. Yeah. So I think I'm still continuously growing, still finding my work rewarding. And I think I've been able to meet my own career aspirations. So I think for the foreseeable future, I'll still be here.
Thanks, Heng. I will answer the question because there's one question on acute setting. So I'll start with the similarity first. So what is similar between acute care and community care for us AHP would be that the basic cleaning and education is similar. But other than that, right, the clinical setting, the application to work and workplace environment, right, that will be very different. So the primary difference is the patients that you see. So in a hospital inpatient setting, right, you typically see patients who are at the acute stage of their condition and require medical intervention. In a community setting, we see clients who are either medically stable or that enough to be discharged from hospital for home, or that there's nothing medical that can be done or needs to be done. So in a community care setting, right, their needs will be quite different, more diverse. If you from my perspective, it's more diverse. And so how we use our rehab perspective to support them will also be different. And why I chose to join community care sector, because most of our population are not in acute setting. They are in the community, like what Casey, like what Abigail was sharing, right? Community care is where most people is, and if you want to be touch lives and to put your optimize or maximize your education in rehab services, right, it's not necessarily just in acute. You apply it very well in community as well. So and community can be a game changer in the way that we utilize healthcare services, like what Casey was saying, right, is from healthcare to what?
Healthcare to health, yes.
Health.
So if we can prevent and manage some conditions, we can avoid unnecessary and expensive medical intervention. So that's good for our taxpayers as well. So furthermore, with our aging population, right, community care has an important role in keeping our community dwelling older persons and aging persons healthy and engaged. So yeah, that's the reason.
Maybe I also chime in here. As what Casey shared as well, I have been in public sector, I've been in private sector as well. But the thing that resonates with me is whether my work contributes to a purpose larger than myself. I know it might sound very cliche, but it is true. What motivates you at work, what you believe in, your values, and how you want to see your contributions and your skills putting into place at work, right? And how that affects and shapes the future of Singapore and healthcare. So that was my motivation for actually joining Comcare. And also, as what Anne shared, we do want to facilitate aging in place and in the community, which is why a large proportion of our population are in the community, and this is where we can actually effect a great change. Yeah, so that's for me. Okay, we can move to the second question.
Okay, there is one question for Endo. The Q&A to ask whether is physiotherapy fun and whether the atmosphere is warm and supportive when you're helping patients. Is it similar to an interactive session? So do you think that physiotherapy a very fun and warm and supportive environment where you're helping patients?
Our work is high touch, so there's a lot of interaction. Same as Heng as well. We are very there's a lot of interaction. There's a lot of interpersonal communication and that. But I don't know how to answer. Is physiotherapy fun? But the atmosphere, to a certain extent, we create the atmosphere. And when we are facilitating the client's rehab, can I not answer the first question, but answer the second and the third question? So you have to think about it this way. Most of our clients, right, older persons, when they come for rehab services, right, they did not come here out of their own volition. They come here because they were referred or they were brought here, right? And try to imagine this is like you going to school when you don't want to, and how is that going to make you feel? So, and if this is the limited communication or community participation or interaction that they have in that week, the whole week that they have, where they are mainly at home and they need assistance with their activities of daily living or walking, right? Then I would very, very much want to create a better experience for them and to make it a warm and supportive rehabilitation session for them.
Maybe I'll just chime in here. I personally have been to daycare centers and rehab centers. I do feel that it is fun in the sense that while what Anne shared, the elderly they come because they have some mobility issues, right? But as you work with them and you see them regaining their mobility, the atmosphere can actually be very happy and uplifting. Yeah, I've seen that happen in some of my observations when I go for those site visits. So it is really how you create that environment. You work with a multidisciplinary team, right? To curate the exercises, encourage the elderly to join in. And as they see improvement in their mobility, then, like that whole environment is actually very uplifting. So that's what I have observed from my point of view. Yeah.
Okay, thank you, Abby, and thank you, Anne. So actually this actually leads into my next question, which is really what has been the greatest highlight for both Anne and also Heng as allied health professionals on the ground for you thus far?
Greatest highlights of your career, any cases that touch you, that you feel like is memorable? Yeah.
For myself, I think there are many cases. I think so. I won't say there is, it's always those, let's say you've worked with this patient and family for a long period of time and you've gone through the struggle with them, and then you see them successfully discharged from the hospital. I think those moments will be very satisfying. But so for me, maybe a highlight is that because in St. Andrews, we also have a palliative care ward. So we take care of patients with end-of-life issues, right? So then before COVID time, we actually have a remembrance kind of service where we actually invite the deceased patients' families to come back to us in remembering those patients that we've cared for. So those sessions, there was something spiritual and something, something very, very meaningful about the experience, sharing that space with those family members and remembering the patients. So that definitely left a very deep impression on me, and it was probably one of the highlights. Other aspects, like I said, is the day-to-day the maybe not so dramatic kind of rewards that we get in our interactions, and also seeing patients and families progress, I guess. And also for myself, highlights will be in terms of my own personal growth, learning in my own profession, and also learning from the experiences of patients and families, as well as other professions as well. So it's not something dramatic, but it is bits and pieces along the way, yeah, that I find it's a highlight for me.
Maybe also just for just that there's also one question that says, then how do you deal with that mental and emotional stress? Because it sometimes does get emotional, right? Yeah. So how do you deal or cope with that as over the course of your work?
Yes. So I guess this part, I think in social work, we were also taught to take care of ourselves. So self-care is very important. Or else you may get compassion fatigue, you may get burnout. And if you don't take care of yourself, it's not possible to sustain this kind of work in the long run. Yeah. Because we have to continue to provide empathy, have to be there for patients and families in sometimes very challenging circumstances, sometimes very highly strung caregivers with high caregiver stress and lashing out at you, or patients who are so depressed and so demoralized by their lack of improvement in their condition. So how do you deal with those things is that self-care, being able to talk to supervisors, colleagues, being able to share and have a safe space in those situations to be able to deal with those emotions, learning good work-life boundaries as much as possible, not totally 100%, but trying our best, and taking care of our well-being, developing awareness. This all goes a long way, and also asking for help when you really need it. There's no shame in that. Different people need help at different times. So if we expect our patients and families to receive our help, I think we also have to be able to be open to help ourselves. Yeah, so I think that has been very helpful for myself.
Thanks. How about Anne? Any greatest highlight in your career or your journey so far?
I kind of went through that a bit when somebody asked me the previous question about the setting. So I am personally very happy when elders respond well, not just to the physical rehabilitation, but also in social relation. So it's related because because the interaction at rehab is important, and we are high touch, and our touch has to be meaningful to them. And when we are able to create or make a meaningful connection with the elders, right, you see changes that are beyond physical improvements. And I think that is very fulfilling for me, because that's how I know that that they have benefited from their time with us.
Okay, thank you, and thank you to all my speakers. We are running a bit, yeah, we are in terms of timing. So I will just perhaps ask maybe 2 or 3 more questions before we end the session for the quiz. So the next question that I would like to move on to would be, what is one common misconception that you all would like to personally dispel about the comm care sector?
Anyone wants to share first? If not, I can go ahead. I actually have 2 common misconceptions that I would like to dispel. Okay, so all of you here attending this talk, you will be young in your life, and I think a lot of misconception I feel generally that young people have is that if you work in an elderly, like a sector that has a lot of elderly folks, it's very slow, it's dull, it's gloomy. But no, it is not true. I assure you. You see the Heng and nodding their heads. It is not true. The elderly, as what Casey mentioned just now as well, right? We are looking at aging as a positive force, and we are pushing towards that direction. So aging is not all dull and gloomy, and the elderly cannot walk about and losing their mobility, right? We are all about empowering elderlies to live a good life and age positively, and how they can continue to contribute to society positively. So that's one big, I feel, misconception I would like to dispel. And I think the second misconception is that that there is not much learning, there is no career progression within a community care sector. But it is not true, as you heard from also Anne and Heng just now, right? Aging consists of a lot of complex issues. It's not just the exercises, it's not just the finances that you help the family with. It comes with a whole host of psychosocial issues. There are complex family issues. So you work with a very diverse team of multidisciplinary, I think, teams as you join us. So there are a lot of skills and knowledge that you can learn and put into place as you join our Comcare sector. So it is actually a very exciting sector that and allows you to progress and enhance your career and learn new skills. So those are the two misconceptions that I would like to dispel. Yeah, so I'll pass on to the panelists to share their views.
Yeah, I guess I have to agree with Abigail. Yeah, so like for my own experience, like I've shared earlier, I was able to meet my own career aspirations. I'm continuing to learn and grow in my role. And also there are definitely a lot of opportunities for you to further your professional development. And in my case, I'm now currently doing my master's and I'm learning a lot, and I still try to digest all that and seeing how to apply it back to my work, sharing it with my team. So I think definitely this myth is busted, like, in my personal experience.
Thanks, Heng and Abigail. I totally agree with Abigail. She got all the points.
Okay, so perhaps there was a query that came in that's somewhat related to this misconception, which is what do you think about work-life balance within the Comcare sector?
I'll let the people on the ground share their views first. Heng or Anne, you have any?
I guess this one there is no because the community care sector is not just one type, right? There's so many different agencies, different settings. So there won't be every setting the situation will be different. So I guess it is definitely possible I can only speak maybe for my own setting. In my own I'm able to maintain very good work-life balance, and so I don't feel that I'm able to complete my work mostly within the work time that I've been assigned. And if let's say I feel really overloaded and all that, I can still discuss with my boss and also see whether any further support or any adjustments need to be made, because we're still, after all, a team and we have to support one another. So but of course, there'll be times when there's things that are urgent, because we're dealing with people's lives and their well-being. So sometimes I cannot say that 5:30 already, I have to go home. And this issue is patient's business. I mean, if we come into this sector, I don't think that mindset is helpful. So in those instances, maybe I have to sacrifice a bit to stay back a bit or to settle certain things, come back on my weekends. But those things are not very frequent. So, and also depending on your setting. So it's more of your own mindset. Like I said, it's also tying into the self-care that I've talked about, being aware of yourself, because sometimes work, you'll not be able to complete everything all the time. It's also depend on what is urgent and what's important. How do you prioritize? All those play in a part. And it's also a learning. As you learn in your professions, you learn how to manage work-life balance issues more, and also be able to take care of yourself more so that you can sustain this career. And that's very
I want to ask, do you have work-study balance?
Yeah, currently, because I'm also studying, because I have to attend class on Sundays. So it is a bit taxing, but rewarding, I would say rewarding. And I think my boss also quite understanding. So in cases where I need to take a bit of leave, maybe to clear up some of my assignments, she has been supportive of that. So far, okay.
So just to it's I think it's about integration, because a lot of times, right, we you find your own way to prioritize the things that you need to prioritize.
Okay, thank you both Heng and Anne. We do have quite a number of queries in regards to the academic criteria for our scholarships and also how to prepare for CCMDA awards. I'll get Kelvin to perhaps answer some of these questions.
Hi everyone. Okay, so there, as what Lynn mentioned, there's quite a number of questions regarding all the scholarships and sponsorship. So I think there's one common question is whether there are scholarships for N-level students. Okay, for the ComCare scholarship and the community nursing scholarship, unfortunately, it's not open for N-level students. But you need not worry, as the CCMDA, the Community Care Manpower Development Award, is open for N-level students. So if you are looking to join the sector, like in the nursing career, or in, for example, one of the course at IT College East is the NITEC in Community Care and Social Services. Such programs, we are also sponsoring students who wants to go for this program. So in terms of the benefits, as what Lynn has shared, is very similar to scholarship. It's 100% sponsored in a sense. Okay, so if you are interested to look out or go to our Bright Sparks portal for the CCMDA, and if you are interested, you can apply through there. Okay, for the next questions on the ComCare scholarship, whether is there a minimum rank of point for eligibility? Yes, there is. So they are looking at minimum like distinction and above. So in general, like B and above. So they do shortlist people with such results. But similarly, if you feel that your results may not be able to meet the mark, you still can apply for CCMDA to sponsor you for your programs as well for your degree studies. Okay, so that's one. So in a sense that you are not, we are open to all. You can apply through various scholarships or sponsorship available that we can support you. Okay, in terms of how do you prepare your CCA and work portfolio, I would say is quite similar, like you prepare for maybe a work interview like your CV similar. Okay, so we do look at your results and what you do holistically. So in the application form, you do need to list down what you do in your CCA. If you have any working experience, you can list it down. So we do look at it together with our partners as a holistic as a person. We don't just look at your results per se. Okay, last but not least, there's one question in terms of the development plan for Community Nursing Scholarship Award recipients. In terms of development plan, I would say it's very similar to all scholarship or sponsorship recipients. So when you join the sector, be it as a scholar or a sponsored student, it's a journey. So we work with you through your studies, assist you along the way. If you have any queries, need any assistance, we will guide you through the necessary resources on the ground. And then once you join, of course, the first step is to consolidate your knowledge, gain your skills, put what you have learned into practice. Then once you are ready, of course, together with your reporting officer, the next step, of course, will be going to your further studies. So like for nursing scholarship recipients, next step will be maybe going for specialization like your advanced diploma, specialist diploma, or even your degree studies. Let's say you have not gotten, or the further down the road, if you look like maybe 10 years, maybe going for a master's. So there is a plan along the way, but at each juncture, it depends on your readiness. Okay, so be it if you are nursing or AHP, similarly. So AIC together with your organization will work with you in terms of your development plan, your career opportunities, what's your next step. So rest assured that be it in a community care or even you go to restructured hospital, opportunities are there for you to grab. Is along the way, what is that at that juncture, what you need in a sense. So we are there here to support you.
Yeah. So just adding on to what Kelvin has shared, we do work closely with MOH Holdings on a framework. So there are broad-based development opportunities, such as, let's say, rotation, projects that you can look at. So these are broad-based, but at every juncture of your career, it would then depend on your individual development. And then we also work very closely with your organization then to see what are the development needs that you would need. So we do work with them on this individual development plans. So yeah, I hope that I've added more clarity to that.
I think there's one more question in terms of the N-level poly students. So if let's say you are currently, I mean, your highest qualification is N-level, but you're studying in, let's say, poly, like diploma in nursing, yes. So scholarship per se, for example, the community nursing scholarship, they will do consider, but they will look at your current poly results as well. So you do need to take note of that. Then similarly for CCMDA, we also do look at both your N-level results as well as your current poly results.
Yeah.
Okay.
So just to also add one more point, do not be too worried about your results. I mean, just go to Bright Sparks, look at the criteria, submit your application, and if you have the passion to join us, just submit your application, and then we would contact you from there and screen through all the applications. Okay.
Okay. I am mindful of the time, so we will end the panel session now. But before we do so, can we get Casey to share perhaps some closing words for us? Thank you so much.
Thank you so much, everybody. I want to thank you for your time with us and also for considering whether community care and our scholarships are right for you. And I thought I should end off by saying that firstly, our role here and together with Anne and Heng is to offer you at least some insights and understanding about what is it like to be in the community care sector, how we contribute, care for, and enable our Singaporeans to be able to age well and live well within the communities. And that is our purpose and important to us. What we would like you to think about is whether the purpose, and what we're working towards resonates with you and whether community care is right for you and your future. So do consider that, and as you think about the scholarship as well, it's more important to think about the future, because after your studies, you will come back and contribute within the sector, and we hope for many years. So that's the question I would typically pose to those thinking about our scholarship. Don't just think about scholarship, but whether community care is right and is the right future for you. If you do have further questions, you want to find out more, please reach out to us. And we will, and I think we have, we will send you in terms of our contact details. I would strongly encourage you to reach out, ask questions, find out both about the scholarship and the profession that you would like to be in, as well as the sector that you are looking to join, because we want this to be the right choice for you. And our role also is to help you answer questions, hopefully reach an informed choice, and to be able to help you sort of move forward into the future that you would like. Another point, it's important to also think about not just community care, but also the profession that you would like to join, because the scholarship would require you to think about which professional area you would like to go into. So again, you'd like to find out more. I'm glad there were questions about specific profession. Please find out from us. We could even help to connect you with, our professional colleagues in other professions that will be able to help to answer the question that you have in mind. So again, it's about reaching the right choices right for your future, and we're here to help you. Do reach out, do find out more, and then we hope you are really able to, reach that decision, not just to be in community care, but for us to be able to partner you in your journey ahead. So our partnership and our support for you is not just now, it's not just when you get a scholarship, but also during your studies and you come back to contribute to the sector. Our partnership, our support for your development, your future will continue. Okay. So at the last point, just to thank my colleagues from Manpower and Talent Division for organizing this, because they work really hard, but also to thank Anne and Heng for spending the time helping us to share what is it like to be in community care together with the audience here. Thank you so much.